Known as gingivitis or periodontitis, is the leading cause of tooth loss in this country. Most of us know to brush and floss, but few people realize that gum disease may actually be a sign of other health problems or may even cause them.
Leslie Lavore, she's the one in the chair, has had gum disease for years, but she's been trying hard to take care of her teeth, in addition to these regular dentist's visits.
I thought it was under control. I had used that electric toothbrush several times a day, flossing several times a day, and Listerine before I went to bed, and that had been enough through the years. And then suddenly it wasn't anymore.
So when her hygienist, Lauren Kilmeade, saw that Leslie's gums were bleeding and swollen despite her conscientious care,
I knew there was an underlying type of systemic condition or underlying health problem.
In fact, Lauren suggested to Leslie that she should be checked for diabetes.
And I said, diabetes, why would that have to do with gums? She said, well, I think it does.
Most people are surprised to find out that your gums are like a canary in a coal mine, early indicators of problems elsewhere in the body.
Gum disease, has been linked, to many other systemic conditions. Some are diabetes, some are heart disease, some are low-term birth weight babies.
A number of studies have linked gum disease to other illnesses. In some cases, the bacteria that cause the gum infection seem to trigger problems elsewhere in the body. And sometimes the gums are the victims of another disease process, such as in diabetes. The important thing, though, is
gum disease, is treatable, and it is very easily monitored with, proper treatment and proper diagnosis.
Turns out Leslie did have type 2 diabetes. Her gums are better now that she's taking care of her blood sugar.
To lose weight, exercise, eat a better diet, and go on a little bit of medication.
Now, there you go. Now, another example of gum disease affecting other body parts is heart valve problems. You should take antibiotics before a dentist's visit to prevent gum bacteria from infecting your valve. All the more reason, again, to brush and floss daily and see your dentist regularly, because sometimes it takes a professional to spot those emerging problems.
So what's the connection between heart valve problems and gum disease? Well,
the gum disease is caused by bacteria, and when you go in for some dental work, especially some sort of a cleaning, you can break those bacteria loose, gets into your bloodstream, and it can, what they call colonize, or actually grow on a bad heart valve. And so that's why you take the antibiotics, to keep that bacterial count down and keep it from infecting your heart valve.
Good thing to be aware of. Thanks, Dr. Max.
You bet.
And that'll do it for Live at 5. Thank you for joining us. News Channel 4 at 6 starts